Hello everyone and welcome to another session of next Saviours Essential Question Series for NEET PG 2025. Now today we are going to have a discussion on the question which is taken out of the Essential Question Series which is provided in the next Saviours app, which is specifically designed for the MBBS final year students because they should know how the questions are going to be asked in the examination, and it is better that they start thinking. It is for the interns who are about to sit in the examination next year, and most importantly it is for those NEET PG aspirants who think that they are giving this examination just to give it. Next year they are going to prepare well because next year never comes, right? So question is that identify the needle which is provided to you in the question, and the options are not only asking about the name of the needle, they are asking about the gauges too. And this gauge is not identified just by giving you the wrapper. They might also be identified by the color codings, and this is specifically what they are asking about in this particular question, and we strongly feel that these kind of the questions are likely to be kept in your examination. Now step by step explanation for this particular question, whatever the answer that you have marked out of the question, the explanation obviously it is the spinal needle. Now all of you practically have seen a spinal needle, and spinal needle is the most commonly used tool by an anesthetist. That is why this question becomes an important one. Now, spinal needle does not mean that there is a single kind of the spinal needle. There are multiple different types, and the types are: one is quinky, which is based on, or how is it identified? It is identified by the ends. Now, quinky needle, which is the most commonly used needle in clinical practice, it is having a cutting bevel, which is traumatic end. Despite this high incidence, it is most commonly used because of the ease of gaining the access to that space. Another one is Whittaker needle. Now, how is it identified? It is having a pencil end, which is obviously not cutting. So it reduces the risk of post-dural puncture headache. Another one is the Sprott needle, which is again pencil point, but it is having a lateral opening, large lateral opening, and it is also non-cutting. It is also less traumatic. And one is the slight modification of the Whittaker needle, which is green needle. But in your question, most likely to be asked is the one which is most commonly used, and that is quinky needle. So this is how these spinal needles are identified. Now comes how to identify the gauges. The gauge is having a color code. Like for 22 it is black, for 23 it is blue, for 24 it is violet, for 25 it is orange. Now, out of these multiple types, the most commonly used obviously is the 25 one. And the second point which you have to remember is that with the increasing gauges, there is decrease in the outer diameter. Means larger the gauge, thinner the needle. And what you have to remember obviously is that the most commonly used needle is that of the 25 gauge, and this is how you will identify it. Also know about the intravenous, that is butterfly catheter, because these also comes with the gauges. So in the explanation, not only is provided about the spinal needle, they are also discussing about the butterfly or the intravenous needles, how they are identified. Like 14 gauge, the color code is orange. For 18 gauge, it is green. For 20 gauge, it is pink. Now, obviously, you might have seen that majority of the times in the emergency where the IV fluid has to be provided in the bolus, then this one is used in the emergency majority of the time, that is 18 gauge. And 22 gauges are most commonly used in case of wards, right, that you have already seen. So these are on the basis of the gauges. How will you identify the butterfly catheters, also known as intravenous catheters? Also, you should be knowing about the epidural to Hoy needle, where you are approaching all the way up to the epidural space in order to provide the persistent pain reduction, particularly used in post-operative patient and where spinal anesthesia is contraindicated. So what is important for you to identify in to Hoy needle? Only one point, just by looking at the needle, are the markings, which are 10 millimeter markings. So that you should be knowing about that where exactly you have reached. And it runs on the concept of loss of resistance, right? So what are the important points that you should be knowing? First is the curved bevel tip, which is characteristic curved Huber tip to guide the catheter cephalad in the epidural space. Thicker shaft, majority of the time which is used in epidural anesthesia are the 16 and the 18 gauges. Markings, it is the black depth marking which help in determining the depth of the insertion. Now this is all we were talking about. It is 10 millimeter in length. Now wings of the gray plate, which allows controlled handling during insertion, and Huber lock hub for the attachment of the syringe to the loss of resistance, that is LOR technique. So this is how you will identify the epidural needle. So hope you have understood everything related to this particular topic. All the best for your future examinations. Remember, more than 2000 of such questions are provided to you in the Next Saviours app, which is available both on Play Store as well as on iOS. All the best for your future examinations. In order not to miss any update, please join our Telegram group. Thank you.